Hey everyone, my name is Dr. Denzel and I'm here at the House of Medics. Tooth decay is a huge topic in dentistry. It's otherwise known as dental caries or cavities. Now, even though it's largely preventable, it's actually the most common non-communicable disease worldwide. How does it occur? It occurs when the bacteria on our teeth start to produce acid that breaks down the hard layers of our tooth. Now, what can we do as dentists to make sure our patients avoid this? You see, most of dentistry these days is based on restoring what's already happened and what's gone wrong. However, if we focus on preventative dentistry, we can stop these issues occurring in the first place. Now, two things our patients really need to know is one, their oral hygiene. We need to be able to educate them on how they should be looking after their teeth and oral health in general. And two is their diet. We need to ensure that they know that some of this food that they're eating is actually causing more harm than good. As a dentist, I really want to impact my patients in the most meaningful way possible. So aside from just educating them on their oral hygiene, their diets and their habits, and making sure that I can do the best work possible, preventative care is always best. And that's why I work with a team in Manchester Dental School called Manchester Imaging Ltd. Here, we have created a medical device that's an algorithm that detects abnormalities on x-rays as soon as you take them. How does it work? Well, you see, AssistDent is an algorithm built to be able to make sure that whenever you take an x-ray, you can make sure you can diagnose the x-ray properly. Another reason for using AssistDent is the technology. It's artificial intelligence. In these days, with the world evolving towards more technology and more the use of AI, you really stand out from the rest of dental clinics by using something like this. It makes you also stand out to patients because having them know that you're using artificial intelligence incorporated within their examination makes them really know that you're putting everything you can into their patient care. And finally, the third most important tip for using AssistDent is it acts as a second opinion. If you're looking at a radiograph and you're unsure of what something could be, the use of AssistDent gives you a second set of eyes on the x-ray. It shows you some areas that you might have missed if you're on a busy day seeing many patients. Using this for each and every one of your patients really gives you that security blanket that you're doing the best you can. So what does this mean? This means that when you go to the dentist and you take something called x-rays or radiographs, we as dentists can see what's going on inside your teeth and on your bone levels as well. Now, to the naked eye, to be able to spot early enamel caries is very hard to see. That's why we've created a device where we had leading professors analyze hundreds of x-rays to be able to detect what early enamel caries looks like on a radiograph. By selecting all of these radiographs, annotating them and building an algorithm, we can now automatically detect what early enamel caries looks like in a radiograph and flag it up for you for the dentist to see. This way, as a patient, you'll be more educated on your radiographs and be able to see yourself where you have early enamel dental caries. Why have we focused on this? The reason why we focused on this is because this is actually reversible. When the dental caries is just on your top layer, which is your enamel, and hasn't crossed the dental enamel junction, otherwise known as the DEJ, to go past into the dentine, it's still actually reversible. So your dentist can send you to the hygienist or can send you to the pharmacist to pick up some fluoride toothpaste to be able to help you remineralize your tooth enamel to get it better and have you caries free. So on the topic of tooth decay, there are two main factors that dentists can teach their patients or patients to understand better to be able to avoid this. The number one thing is oral hygiene. Oral hygiene is key to prevent tooth decay, gum disease, and other common oral pathologies. What you are meant to do is brush your teeth 2 times a day. Once in the morning, but more importantly, once in the evening. The reason why it's more important to brush in the evening is because throughout the day, we have our breakfast, lunch, and dinner. We're eating all of this food and sometimes food particles get left in our mouth throughout the day. So at night time, if you don't brush your teeth properly, these bits of food turn into bacteria that then produce out acid that go to work on your teeth throughout the entire night. You see, during the day, we have something called saliva that comes into our mouth and takes some of the food particles away. However, at nighttime, our saliva production is reduced. And that's why sometimes when you wake up, you have morning breath or dry mouth. So, aside from brushing twice a day, once in the morning, once in the evening, you need to make sure it's for 2 minutes each time. You can also do something called interdental cleaning, otherwise known as flossing or using TP brushes. This is key because it gets rid of any bacteria or any food particles that's stuck in between your teeth that a normal toothbrush can't do. So there, oral hygiene, very important. Aside from brushing and flossing, we can do something called tongue scraping as well. Tongue scraping is a method of sticking out your tongue and taking out all the bacteria on the surface of it and making sure it's all gone. This really helps if you're suffering from bad breath, as most of the bacteria on the tongue can really start to have a foul odour. Now, aside from good oral hygiene, what else can we do to prevent dental caries or cavities? Another thing is our diet. You see, a lot of sugar in our diet can cause detrimental effects not only to our oral health but our systemic health as well. Ranging from diabetes, being overweight, even gum problems, they can all arise because of the amount of sugar we have within our diet. So it's very important to control this. And especially within the heat over here now, it's important that also that we consume enough water. I hope that's been useful for you and you understand the importance of being able to tackle tooth decay and how preventative dentistry is what we're leaning towards. With the use of AssistDent and with the use of educating our patients, hopefully we can get rid of the #1 non-communicable disease worldwide. Thank you very much.